My name is Jay Chappell, staff side lead at St Mary's Hospital. At the beginning of the outbreak of COVID-19, I knew I would be needed back on frontline duties. I ended up supporting the Western Central Community Nursing team, and there are three things that stick in my mind about my COVID experience. Firstly was the guidance from Public Health England and PPE. We had PPE on the island and we had plenty of stock, and it was distributed really well and quickly and efficiently. However, the guidance from Public Health England slowed that down in what we should be wearing and when we should be wearing it, causing huge anxieties and stress levels within staff. However, once we got the guidance from Public Health England and everybody knew what they were doing, things were settled and we were able to crack on and do what we needed to do. Secondly, I was so shocked at how COVID-19 had spread across the care homes in the west of the island where I was working. It really was a reality check for me, and that this was real and not a test. And thirdly, how immensely proud I am of our workforce. As staff side lead, this is something that we encouraged. We knew that staff would be anxious and worried about working in different areas with different practices, but they mobilised, they cracked on, and it was absolutely brilliant, and I'm immensely proud of that.
Hi, my name is Richie Divina. I'm healthcare assistant from Whippingham ward and now currently working at same-day emergency care, better known as STAFFSIDE. I had symptoms of COVID-19 last April, just a few days after Public Health England announced the new guidance of PPE, which in my opinion was a bit too late for us, some of us healthcare workers. I was unwell for 2 weeks with temperatures of around 38.6, even with regular paracetamol. Miraculously, I have recovered and eventually was back to work after 3 weeks at Willow Unit, looking after patients who are on their last days of life. This was the time where the proper reality has hit me, looking after patients who are dying because of the virus. In one of my shifts, I was sent to isolation ward to help, looking after 5 patients in a bay who are all COVID positive. I went home that day depressed. I was in tears as more deeper realization has hit me. Seeing patients who are struggling to breathe, even with a high flow oxygen, knowing that they would not make it. Seeing a member of family in tears, not knowing what to do. And this could have been me or my wife a few weeks ago. I was depressed, I cried, I was angry to see people break the lockdown rules. One thing for sure, this virus is no joke. COVID-19 kills, and that's reality.
Hi, my name's PIPPA. I work here in the emergency department as emergency department assistant. Now it's a very difficult time where there's the virus going around and everybody is wearing the mask, which is very, very difficult for me to live with because I'm deaf. The staff here have been very supportive. Some have been learning to sign, and I'm very proud. They are quick learners, and it's a big support for me. I want to thank you all the staff in the emergency department. Thank you.